from the station that's on your side. This is News 12, NBC 26 at 11.
Good evening. We begin with COVID in schools. Both Jenkins and Warren County schools announcing there will be no in-person classes through Labor Day.
It comes just days after Governor Kemp says he will send additional medical staff to state hospitals with a focus on those rural counties.
To expand those efforts, I'm announcing today that Commissioner Noggle and her team will increase the total number of state-supported hospital staff from 1,300 to 2,800. Specifically, 170 of these new staff will go directly to rural hospitals.
Other counties shifting back to a virtual format: Tolliver, Screven, and Glasscock. And here's a look at the vaccine rates in those rural counties. Glasscock County is the lowest with 26% of people eligible fully vaccinated. They're followed by Tolliver with 35% and Screven County with 36%.
And with all that in mind, we're told school leaders in one of those counties are choosing to take a more cautious route when it comes to this latest surge.
We reached out to find out what some of these counties are planning with so many districts going virtual. Sloan O'Cone joins us now to break it down for us.
The majority of school districts who decided to go remote for the next few weeks made their decisions after numerous positive COVID cases in their school. But I spoke with the superintendent of Warren County Schools, and he says their decision was to be proactive instead of reactive.
The decision is one I feel very confident about because it's one out of precaution and not one of we have no choice.
Superintendent Harris says the decision came after looking at other school districts seeing spikes of cases and the impact spread could have on their whole community.
The challenge of being in a rural area with limited health care support and oftentimes having to go outside the county to get the necessary services that are needed, that's important to be proactive so we're not in a situation where you have an outbreak with limited health care support.
Challenges like limited COVID tests, vaccine clinics, and quality care medical centers. Jenkins County also made the same call, but their hand was forced after positive COVID cases. They will be virtual for the next 2 weeks and will adopt a hybrid system until the beginning of October. But Dr. MacArthur says despite schools closing to stop the spread, that's not all it takes.
What would really make a difference is if in that period of time more people got vaccinated.
According to the Georgia Department of Health, 38% of Warren County and 27% of Jenkins County are fully vaccinated.
It is a mess. It can be managed.
Warren County kids will work on packets for the next 2 weeks since the county has so many connectivity issues. Leaders will use the time to make plans should they have to switch to the entirely remote.
Ever-changing situation. Sloan, thanks for the update there. Today, Dr. Jose Vasquez was on a